Hi, I'm Dwayne Taylor, and I'm the president of the American Academy of Otolaryngology Head and Neck Surgery, the organization that created and maintains the patient education website, enthealth.org. I'm a practicing otolaryngologist, or ear, nose, and throat physician in Bethesda, Maryland, and I'd like to thank you for coming to this site. The coronavirus disease has had an enormous impact on our lives and our communities. And even the way you connect with your doctors and the way the doctors connect with you has been affected. First, if you're experiencing any of the following symptoms, please contact your primary care doctor's office to see if you need to be tested for COVID-19. These symptoms may appear within 2 to 14 days after exposure to the virus. They can include cough, shortness of breath, difficulty breathing, fever, chills, muscle pain, sore throat, or new loss of taste or smell. This list does not cover all the possible symptoms. There are other less common symptoms that also can appear, and these include gastrointestinal symptoms like nausea, vomiting, or diarrhea. I must also make the point that you should seek emergency medical attention if you or someone you know is showing any of these signs, including trouble breathing, persistent pain or pressure in your chest, a new onset of confusion, an inability to wake or stay awake, or bluish lips or bluish face. Beyond these things I just mentioned, it's also important that you contact your doctor if you think something is wrong, or if you or a loved one is just not feeling well or experiencing symptoms that require medical attention. Now, there are a number of symptoms that you do need to take seriously and that need medical attention. And these are things like a newfound lump in your neck, ear pain, sudden hearing loss, loss of voice or strained voice, and so many other symptoms that are non-COVID-19 related. The pandemic is not a reason to avoid contacting your doctor. Call your doctor to talk about your symptoms and the best way that you can receive care. It could be through telemedicine. It could be through an office visit. It might be that your doctor wants you to get a test or blood work. But just make sure that you have the conversation with your doctor to decide on what the best next step should be. The coronavirus has impacted different parts of the country in different ways. So if you're living in New York City, it might be different than what you're experiencing in Sun Valley, Idaho. Many practices are changing the way that you check in and interact with your doctors, the nurses, the front desk, and other staff at the office. So this is why communication with your doctor's office is so important, so that you know what to expect. You're not taken by surprise with these changes or taken off guard, and that the added safety measures that you're aware of. Besides going to your physical doctor's office, as was mentioned, telemedicine has been one of the ways that doctors continue to treat patients throughout the pandemic, and will likely continue for a while. To explore this option with your doctor, give them a call, see what's available, and ask them about the technology that they use. You can read more about telemedicine best practices for patients and their families on this website, enthealth.org. And just click the search function and type in telemedicine. When you need to see an ENT doctor, rest assured that your safety is of our primary importance, whether you're seen in the office or whether you need a surgical procedure. Our specialty has established safety protocols to guide our physicians in the most current recommendations that will allow them to provide you with the best care to you safely. Please know that any new measure in place to see your doctor is simply to take those extra precautions for everyone's safety. The coronavirus has taught us that there are many ways we can treat patients, and there are many ways for our patients to connect with us. Getting the care you need for yourself and your loved ones is first and foremost. Stay safe, stay informed, and we wish you well today and in the future. Thank you.